should be. Maybe we should get started. First of all, I want to welcome everyone to the webinar on hiring, discrimination, and newcomer resilience. Quite obviously, I'm not Debbie Douglas. Unfortunately, at the last moment, she got called away, but she does send her regrets. And I am John Shields, and I'm from Ryerson University, or maybe I should call that X University, as we're in the process of a name change, from the Department of Politics and Public Administration. And I'm going to be chairing the session today. I did want to sort of, we've got three different presentations and four presenters. You'll note down below, of course, that you have the chat. And please, as we go along, if you have comments to make, you can enter them into the chat. Also, you can write questions, and I'll try to monitor that as best I can in the chat as we go along. So please feel free to actively use that. Also, towards the end, I'm going to have everybody do their presentations first, and then we'll open up the floor for questions from everybody. And I think I'll try to monitor, as I said, the chat function for questions as best I can. And also, I think you can use the raise hand function, and we can sort of get you in to ask what should be short questions, and then the panelists can respond. So I think without further ado, we're going to get this underway. Just for the presenters, we have about 15 to 20 minutes for each of you to present with. What I'll do is I'll give you just a 2-minute warning once you're getting to that point in time, if you're getting close to that 20-minute slot. Maybe what I'll do is I'll do the introductions for each speaker as they come up. And our first speaker today is going to be Jenna Hennebry, who holds a PhD in sociology and is an associate professor affiliated with the Basile School of International Affairs, and is the director of the International Migration Research Center at Wilfrid Laurier University. Her research focuses on international migration and mobility, with a specialization in lower skilled labor migration with regional expertise in Canada, Mexico, Morocco, and Spain. And Dr. Hennebry is her research portfolio includes comparative studies of migration policy and foreign worker programs, and an emphasis on migrant rights and health, migration industries, non-state migration, mediation, transnational families, and the role of remittances, I'm having a hard time saying that word today, in development. Recent work examines the role of bilateral labor mobility agreements in protecting migrant rights and social protections, non-state actors, and an expanding migration industry in foreign worker programs, and shifting regimes of labor migration governance on a worldwide basis. And Jenna is going to be speaking today on the resilience shuffle with respect to temporary migrants and Canadian communities. I think without further ado, I'm going to turn it over to Jenna.
Thanks, John. And just a note of correction, I'm no longer and haven't been the director of the International Migration and Research Center for quite some time. It's actually Alison Mounts has been in that role for 4 years. So this is a very old bio. It's okay. And I probably was supposed to send something new. But anyway, what matters is I am still, of course, part of the International Migration and Research Center, which is where I come from this work. And what I'm going to talk to you about today comes from project that we've been involved in at the IMRC with the folks at York University leading the BMRC project. So I'll talk a little bit about that and our connection and what we're trying to do in this project. So I thought I'd share some of that work in the seminar today. Obviously, there's a lot of other things I could talk about around migrant farm workers, around gender and migration, and I'm happy to discuss anything like that in questions, but this is just going to focus in on one study that I've been doing with colleagues. Tara Bedard, who's from the local immigration partnership here in Kitchener-Waterloo, Margaret Walton Roberts, a colleague of mine at the IMRC in Laurier, and Alison Petroziello, who's a PhD student in the Global Governance Program. So that's what I wanted to talk about today. And I was being witty in my title, which is I'm calling this the Resilience Shuffle, Temporary Migrants and Canadian Communities Dance Around the Problem. I kind of wanted to start from that as a way to flag some of the realities around two-step migration, and to be thinking about the two-step, the shuffle, the sidestep, and all of those different cool dance moves. So that's a way to get us started. So also we were having some difficulties. So I have a colleague, Shanaz is going to be doing my slides for me. So apologies, I'll be saying things like next slide, but you can ignore that and focus on hopefully what I'm going to say. So what I planned on talking about was coming out of this project funded through the York University partnership grant headed by Valerie Preston, which brings us actually all here today. And I wanted to share some from what we've been doing there. So this project is really focused on people with temporary status, so those that might be on work permits or international student permits, or without status and in the middle of trying to claim a status as refugee claimants, and those that are on various open or closed work permits, and to just look at that population in the KW context, obviously in the context of Canada more broadly. This is the main source of what we've done is done interviews with that population, as well as we are in the process of analyzing data from the Waterloo Region Immigration Profile and data from some organizations, settlement data in the community. So some of that I'll share today, but not all, just to get us started. So next slide, please. So, we know from some more recent studies, being done by Feng Hu and Pico and others at IRCC and also at StatsCan, looking at the way in which we've seen the changes in how people are coming to Canada and to the communities in Canada, and here looking at the way in which increasingly we see people coming into Canada through other avenues as compared to just the federal skilled worker program, which used to be the primary way that people came to Canada as permanent residents, as economic migrants. Increasingly, we're seeing the use of the provincial nominee program and the Canadian experience class. And I think this is an important thing to get a handle on, because it's telling us that there's the rapid expansion of the use of these programs, and both of those programs actually require candidates to have Canadian experience and work experience. And so it's changing the model by which people are coming to Canada and settling in Canada, or attempting to settle in Canada, whatever transnational reality that might look like. But at least in terms of getting access to PR, that's the process increasingly by which this is happening. And it's been driven by these two particular program streams, which has increased the share of 59% of the economic immigrants are actually coming in through those streams now, and not the federal skilled worker program. Next slide, please. So, okay, yep, there we go. And so what does this mean in thinking through it at a local level? This is part of what we were trying to get at and think about when we were thinking about starting this project. What it means is you have more temporary migrants than ever in Canadian communities. You have more variance in the types of temporary migrant categories than you've ever had. And from a community response perspective, it's a challenge in terms of being able to provide services to and assist newcomers, because it's a different process than it used to be. And you can see here, when you look at Waterloo, we've seen a growing number of people entering KW as newcomers, not as permanent migrants or as refugees, but as international students in the International Mobility Program and as under the Temporary Foreign Worker Program. So what I'm trying to demonstrate here is that there's been a growth in all of those categories, and that it's meant that the landscape of service needs has changed. Next slide, please. You can also see that in Waterloo Region, the two-step migration process, the going from temporary to permanent, is now the dominant pathway in the region. Most people that are settling and getting permanent residency in KW or in Waterloo Region have worked or studied in Canada first. What's that telling us? That's telling us that they're spending time in the community before they're getting access to their PR, and that they may have different kinds of experiences of the process of accessing services and settlement. In the Immigration Partnership Immigration Survey that was recently conducted, we found that among international students, for example, they'd been here 1 to 5 years. 68% had been here 1 to 5 years. So they're spending quite a long time in that temporary status without having permanent residency, which is kind of my point here. And then when looked at all the different temporary statuses, frequently mentioned challenges, which I'll pick up on in a minute, were things like finding work, social connections, affordable housing, and addressing isolation. We also saw that not all temporary migrants generally weren't accessing services in the same rate that other immigrant categories were, that they were actually less likely to access services, in part because they weren't aware of them. That's backdrop. Next slide, please. What we found when analyzing our data, so we did these interviews with service providers or people working in settlement more broadly, as well as with immigrants or newcomers rather in temporary status. And we found these were sort of the common themes or challenges that were emerging. And they actually are echoing what we're finding in this survey also done in the community, sorry. So, sorry, the employment issues in terms of not being eligible for certain employment because of having a temporary status. One interviewee remarked that they have a 9 in their SIN number, and so they think that that's one of the reasons why employers just pass over their files, because they're too complicated and they don't want to have to deal with people that are here on temporary foreign work permits, even if they're open work permits. That there's a great deal of insecurity in terms of knowing a job will be continued or not because of the temporal nature of the work permit. They may not have all the documentation they need, and some have expressed concerns around discrimination as well. In terms of housing, some of the issues have been things like not being able to get a mortgage, not being able to get enough references, not being able to get a car, and not being able to get a car loan. All these types of things that generally require you to have both permanent employment and usually permanent residence. They're asking for this increasingly. And so many people we spoke to said that they found this to be particularly challenging and felt that this was in part a kind of discrimination aimed at them. family separation and strain, stress across borders, families being separated, because quite often temporary migrants don't have visitor visas for family members. They don't have multiple entry visas where they can come and go, particularly if they're on a closed work permit, and delays in family reunification because of timing of certain types of things. So you'll see this in one quote that I have from one of the interviewees saying, they missed like every important family event in country of origin because of their timing of their permits and being concerned about not being able to come back in. Challenges in terms of access to PR, very common. Everything from ineligibility and challenges in qualifying to not understanding the system to lack of documentation and lack of support and information to navigate through that, as well as access to services ranging from access to healthcare to childcare across the board. Next slide, please. Here's a couple of quotes. I won't read them all because we're in this virtual environment where your screen is as big as mine, but I'll highlight a couple of themes from them and you can read them while I do that. The first is that quote about missing all the family events. The second has to do with not being able to access OSAP. The third has to do with not being able to get credit. The other has to do with certification and getting exams recertified in terms of having their accreditation of their previous healthcare experience as a physician. The other next slide has to do with this experiences of racism, of trying to ask for assistance and not being able to get the support that's needed from the organizations, like getting access to clothes, bike programs, daycare, these kinds of things, really challenging for people with a visitor's permit that might be accompanying someone who's here as a temporary foreign worker or someone who has a work permit but won't necessarily have access to all of these things. Next slide, please. A number of the service gaps we recognize here, and actually just a quick note to also say from the immigration survey, temporary migrants were more likely to have experienced discrimination than any other migrant category in the survey. And this is a survey that was carried out, that's carried out annually in the region. The expiry on health cards and on SIN numbers, these kinds of things leads to really challenging administrative hurdles that often leave people out, and wanted to flag a couple of examples of that here as well. And in healthcare, it translates into not just having access to care, but also not having access to family doctors and things like not accessing types of care like sexual and reproductive health care, which is a ongoing kind of care. It's not emergency care necessarily, but it's required to maintain your health. Temporary migrants were also more likely to say they didn't go to hospital, clinic, or have a healthcare professional visit the entire time they were in the country. And this is, I think, really important, especially when we see that they're here for quite a long period of time, between 1 and 5 years being quite common. And towards that 5-year mark, that means not seeing a doctor, not seeing a dentist, not having sexual and reproductive health care that's vital to ensuring people's long-term health and avoiding things like cancer. Next slide, please. Some of the things that we've seen and other experiences that people had in terms of employment and in terms of access to residence, real challenges in trying to access the services. And this is where the service community has been really interesting, because you can see on the left-hand side, I guess it's the left, with the chemist from Libya talking about going to one agency and then saying, sorry, no, we can't serve you because you're temporary migrants, but we're going to think about and strategize how to get you services through this other partner, the YMCA, because they can use this other more flexible approach and in order to provide you services. Next slide, please. Some of the resilience strategies we've seen at the individual level, I'm trying to categorize in somewhat pithy ways so we remember them, but and I need a better image or icon for one of them, at least for the shifts. But the idea here is that I see a lot of respondents saying to us that they get multiple jobs and they take on multiple roles, they volunteer, they teach, or they volunteer, they work, they go to school, and they take on multiple shifts. So they're shifting all the time to try to be able to have some degree of success in their sort of migrant trajectory. They're doing the shuffle, what I like to call the shuffle, where they are shuffling their priorities and their responsibilities. So they're thinking about, okay, trade-offs about parenting, about I'm not going to go to school now, so my spouse can go to school and we can have, and then I can work to be able to offset those costs. So really having to do a lot of challenges and shuffling of their priorities and of their lives in order to be able to make things work. They're increasingly doing the kind of the two-step where they're increasingly looking to go permanent or temporary first and then permanent and applying for PR next. That is the norm among many newcomers in the Waterloo region. And then they're also doing the sidestep where they're going from being international student, open work permit, then they might go to being an international student again, and then they might go, to trying to get PR. So there's a lot of sideways moving as well. And then they're also doing what I'm calling the borrowing BOP, which I think is silly, of course, but is basically about borrowing money and resources. But it's also about informal borrowing and resources. It's about family and friends. It's about, saying, okay, we're going to stay in your basement for this period of time for free, and then we're going to owe you. So it's creating this context of debt that's far beyond just the dollars. Next slide, please. Here's a number of quotes. I won't go through them all again, but just flag to here that, the side steps happening as people do things also across provinces. So looking for PNP opportunities where they might work for them. Also, the creative thinking in terms of resilience strategies about engaging in volunteer work in order as a way to sort of build experience and try to get integrated into the community. Those are a couple of examples. Next slide, please. So some of the strategies we've seen at the community level, I think, are interesting as well, because remember, resilience isn't a one-way deal, and it doesn't just belong with individual migrants. It's something that happens at the system level. Resilience happens between the community and the individual. It doesn't belong to one in particular group. And I think we've seen communities like KW try to have more resilience in terms of the changes that have been happening. They're doing more data gathering and analysis and trying to have that inform their thinking about service provision. They're modifying eligibility requirements, combining service groups, doing some really creative accounting. I've seen some great collaboration and burden sharing, but I've also seen some offloading to private sector employers and colleges that I think can also be problematic. Next slide, please.
Just a 2-minute warning, Jenna.
Yeah, I'm almost done. I have 2 more slides actually, so that should be fine. So here, just some examples where you've seen challenges in eligibility, service providers trying to find ways to make those work. But then you've also seen the larger quote here by the meat packing plant worker. That's hard to say. Basically paying an individual to help them do some of the navigation that has maybe been done historically by for permanent migrants by settlement service providers and others, and also employers stepping in to do more. Next slide, please. So in conclusion, see, I told you I was almost done. We've seen an increase in complexity and a plethora of pathways that I believe heightens challenges at both individual and community levels. This is system level challenge. We're seeing a growing tendency for the temporary migration 2-step, and this new 2-step pathways has not been matched by comparable shift and settlement service provision model or funding system, something that John has actually written about elsewhere. And we also see that the resilience pressures and strategies such as the shuffling and the sidestep aren't things, in my opinion, to be celebrated, or even things that we should be trying to move towards. They're signs that the system's not working and we need more change. I'll end there. Thanks. Next slide, so I can say thank you.
Great. Thank you, Jenna. That was terrific, and we'll get back to questions a little
Thank
bit
you.
later. Our next presenters are Antoine Bilodeau